Up to 70% of clinical breast cancer patients are taking over-the-counter supplements right now.
Yeah, which is honestly a massive number.
It really is.
Yeah.
And, many are paying out of pocket for these remedies to manage menopausal symptoms, mostly because they want to avoid traditional hormone replacement therapy.
Right, they want a more natural route.
Exactly. But here is the terrifying part we're exploring today. Some of those natural remedies might actually be shielding their tumors from the very chemotherapy that's trying to save their lives. So, welcome to the deep dive.
Thanks for having me. And yeah, it completely shatters this illusion that we all have. Like, just because a bottle has a nice picture of a green leaf on it, we assume it's biologically inert.
Right, like it's just a harmless plant.
Exactly. But today, we're looking at a stack of really revealing sources to answer a vital question. Are there hidden risks and dangerous drug interactions associated with popular menopause supplements?
And we have some fascinating materials to go through for this. We're pulling from clinical literature on breast cancer interactions, uh, adverse event reports from the UK's MHRA, and the liver tox database.
Which has some pretty harrowing case studies, by the way.
Oh, absolutely. And we're also looking at this really interesting human factors study from JMIR on a new clinical tool designed to navigate these dangers in the doctor's office.
Yeah, so our mission today is to decode what natural actually means when it enters your body. We're going to look under the hood, like at the cellular level, to see how these herbal remedies are secretly communicating with your powerful prescription medications.
Because your body doesn't read the label on the bottle, right?
Huh.
It just processes the chemistry.
That's exactly it. When you introduce these complex, really concentrated botanical compounds into a system that is already managing highly targeted pharmaceuticals, you basically initiate a biochemical turf war.
A turf war. I like that.
Yeah, these chemicals interact, they compete for the very same metabolic pathways, and in some cases, they just completely undermine each other.
Okay, let's unpack this mechanics of that because I want to start with how plant-based supplements interact with one of the most critical hormone-based medications out there, tamoxifen.
Right, the life-saving drug for estrogen receptor-positive breast cancer.
Exactly. And to understand the interaction, we kind of have to look at how tamoxifen actually works. It essentially acts as a decoy.
A really effective decoy.
Yeah. So if a breast cancer tumor relies on estrogen for fuel, tamoxifen goes in and binds to the estrogen receptors on the cancer cells. It plugs them up so the actual estrogen in the body can't get in.
It starves the tumor.
Yeah.
But here's the issue. Many popular menopause supplements contain phytoestrogens.
Plant-based estrogens, right, like red clover or soy isoflavone.
Exactly. And because these plant hormones have a molecular structure that is incredibly similar to human estrogen, they also seek out those exact same receptors.
Okay, so if tamoxifen is like a specialized security guard trying to change the locks on the doors to keep the fuel out, taking these phytoestrogens is like flooding the bloodstream with millions of duplicate keys.
That is the perfect analogy. Even if they are weak plant hormones, they are wandering around, sliding into those locks, and potentially just opening the doors right back up.
Wow. And the cancer gets fed again.
Right. The pharmacological data reveals this massive tug of war at the cellular level, and the results are, well, wildly unpredictable. Some natural products actively fight the chemotherapy.
Like angioretin.
Yes, tangeretin. It's a citrus flavonoid that's often isolated for antioxidant supplements. In laboratory studies with mice, tangeretin and certain other herbal formulas were shown to just completely neutralize tamoxifen's tumor-inhibiting effects.
That is wild.
It is. The botanical compound competitively bypassed the drug, and in some observed cases, the combination actually increased the tumor weight.
So the supplement effectively built a fortress around the cancer, protecting it from the chemotherapy.
Exactly. You take something thinking it's a harmless, antioxidant boost to help your body recover.
And you're actually fueling the exact biological process the chemotherapy is trying to shut down.
Precisely. And this is what makes it so complex, the data swings both ways.
Right, because there are other compounds that do the opposite.
Yeah, things like curcumin, derived from turmeric, or really concentrated green tea extract, those actually appear to enhance tamoxifen's effects.
By doing what, exactly?
They modulate entirely different signaling pathways inside the cell, ultimately inducing apoptosis.
Apoptosis, which is programmed cell death.
Right. So by triggering that mechanism, these specific supplements make the cancer cells way more susceptible to the tamoxifen.
Okay, so it's not just a blanket rule that all supplements are dangerous.
No, definitely not. But the issue is that without a clinician mapping out the specific cellular pathways of your exact tumor biology, mixing an over-the-counter herbal remedy with a targeted chemo drug is basically playing chemical roulette.
Because we simply don't fully understand the rules of the game for every botanical compound yet.
Exactly. If a patient takes an unverified supplement during oncology treatment, they're operating entirely in the dark. The active ingredients could be inducing apoptosis, or they could be neutralizing the primary line of defense.
Okay, so if these compounds are powerful enough to hijack receptors in breast tissue, we really need to look at what happens when they hit the body's main chemical filtration plant, which is the liver.
Yes, the liver. This is where we get into black cohosh.
Right, which is arguably the most popular over-the-counter herb for treating menopausal hot flushes.
And the liver toxicity data surrounding black cohosh is where this deep dive takes a very dark turn.
Here's where it gets really interesting, because I have to push back on this.
Go ahead.
That doesn't track logically for me. If you look at indigenous medicine in North America, populations have used black cohosh safely for centuries.
That's true.
It's deeply rooted in traditional practices, and many clinical trials show a completely safe profile. So if it causes acute liver failure, how did it ever become a trusted traditional remedy in the first place?
Well, you aren't the only one confused by that. That paradox puzzled hepatologists and researchers for a really long time. The traditional safety profile simply did not match the modern adverse event reports.
And those reports are pretty harrowing.
They are. The liver tox database documents this case of a 54-year-old woman. She started taking 100 milligrams of black cohosh daily for her menopausal symptoms.
Which doesn't sound like a crazy dose for an over-the-counter supplement.
It doesn't. But within 6 months, she developed severe fatigue and deep jaundice. Her liver tissue underwent massive cellular death, leading to fundamental organ failure.
Oh my God.
Yeah. She required a deceased donor liver transplant just to survive. And tragically, she died from excessive hemorrhage during that surgery.
So an over-the-counter supplement triggered a cascade that ended in a fatal organ transplant.
Yes, and global health agencies realized this was not an isolated anomaly. By 2006, the UK's MHRA had tracked 21 severe cases of liver toxicity specifically associated with black cohosh.
Ranging from, like, abnormal liver enzyme function to acute hepatitis, total liver failure, right?
Exactly, which prompted agencies around the world to mandate severe liver warnings on the packaging.
So how do we square that circle? How does a traditional remedy used safely for generations suddenly destroy a 54-year-old woman's liver in 6 months?
The answer lies in the supply chain. It's not necessarily the plant itself.
Wait, what do you mean the supply chain?
Well, when researchers finally conducted DNA barcoding and liquid chromatography testing on the commercial black cohosh products sold on store shelves, the results were just staggering.
What did they find?
Up to half of the products consumers were buying were derived from completely different, cheaper plant species.
Half of the bottles on the shelf didn't even contain the correct plant.
Exactly. Instead of using Simicifuga racemosa, which is the true North American black cohosh used in those safe clinical trials.
And by indigenous populations.
Right. Instead of that, manufacturers were substituting related Asian species like Simicifuga dahurica.
That is, that's borderline fraudulent. Yeah.
It gets worse. Furthermore, the chemical analysis showed that 1/3 of the products were actively contaminated with just unidentified botanical matter.
So the modern consumer isn't even taking the traditional remedy.
No. They are taking an unregulated, heavily concentrated mystery cocktail processed in a factory halfway across the world.
Wow. And so when the liver encounters these unverified, highly concentrated foreign botanicals,
The hepatocytes, the main functioning cells of the liver, they experience catastrophic metabolic stress. They're trying to break down toxic compounds they were never evolved to process in such high doses.
okay, so the liver acts as the ultimate bottleneck for your entire system. It has to filter out this adulterated black cohosh, but it also has to process your daily prescription medications.
Exactly.
So if the liver's machinery is damaged or, like, hijacked by a supplement, the way your prescription drugs behave in your bloodstream completely changes. Which brings us to the blood thinner minefield.
Yes, specifically a drug called warfarin.
Right. Warfarin is a widely prescribed anticoagulant, but it operates on a notoriously narrow therapeutic index.
Super narrow. The margin between a dose that successfully prevents a stroke and a dose that causes internal hemorrhaging is incredibly small.
It requires constant calibration.
It does. And if warfarin relies on the liver for processing, we have to ask what happens when you introduce a popular menopausal mood supplement like St. John's wort.
Right, because St. John's wort is huge for mood swings. So what does it do?
Well, St. John's wort alters the liver's underlying metabolic architecture. Inside your liver, you have a family of enzymes called cytochrome P450, or CYP enzymes.
CYP enzymes, got it.
You can think of them as the liver's chemical pac-men. Their entire job is to chew up foreign chemicals, toxins, and drugs so they can be excreted from the body.
Okay, so they're the cleanup crew.
Exactly. But St. John's wort is a massive enzyme inducer. It basically sends a signal to the liver to rapidly manufacture millions of extra CYP pac-men.
Oh, wow. So if you are stabilized on warfarin and you start taking St. John's wort for mild depression or mood swings, your liver suddenly has a massive army of these TACmen.
Yes, and they start chewing through the warfarin much faster than normal.
So the liver clears the blood thinner out of your system before it even has a chance to work.
Precisely. Your blood concentration of warfarin plummets, essentially removing your protection against deadly blood clots.
That's terrifying. Just from an herbal tea or capsule.
And because St. John's wort ramps up these specific enzyme pathways, it aggressively clears out other medications too.
Like what else?
It can lead to withdrawal symptoms in patients on antidepressants, and it causes breakthrough bleeding or total contraceptive failure for those on birth control pills.
Wait, it can make your birth control stop working?
Yeah, the liver processes the hormones out too fast.
We also see major red flags in the sources regarding evening primrose oil, which is incredibly common for managing night sweats.
Oh, yes. Evening primrose oil alters blood chemistry, but through an entirely different mechanism than St. John's wort. It inhibits platelet aggregation.
Platelets are the sticky cells in your blood that clump together to form a clot when you get a cut, right?
Right. And evening primrose oil makes those cells less sticky.
So if you are already taking an anticoagulant, adding this supplement compounds the effect.
Exactly. It creates a severe hidden internal bleeding risk.
Wow.
Additionally, the clinical literature shows that if evening primrose oil is taken alongside certain psychiatric medications, specifically phenothiazines, it can lower the neurological threshold.
Meaning it actively raises the risk of seizures,
Yes.
which is just a staggering cascade of side effects originating from the vitamin aisle. But the detail from the sources that perfectly illustrates how delicate this biological balance truly is what we're calling the multivitamin trap.
Yes. This is the ultimate paradox of trying to be proactive about your health, the vitamin K interaction with warfarin.
Right. It is perhaps the most subtle yet dangerous interaction we face.
Absolutely.
Our sources outlined cases of patients who were perfectly stabilized. Their blood thickness was exactly where their cardiologist wanted to be.
They were doing great.
Yeah, and then they decide they want to improve their general wellness. So they start taking a basic, generic, over-the-counter daily multivitamin.
Just a standard vitamin.
But within a few weeks, their blood becomes dangerously prone to clotting again. The warfarin stops working entirely. And why? Because that basic multivitamin contained just 25 micrograms of vitamin K.
And to understand why 25 micrograms, which is practically a speck of dust, can derail a major cardiovascular drug, we have to look at the mechanism of warfarin itself.
Okay, break that down for us.
Warfarin is a vitamin K antagonist. Think of the clotting process in your body like a game of musical chairs.
Okay, musical chairs.
Your body needs vitamin K to sit in specific chemical chairs to build a blood clot. Warfarin works by rushing in and taking up all those empty chairs so the vitamin K can't sit down.
So the dosage of warfarin is delicately calibrated against the normal amount of vitamin K you get from your daily diet, like from leafy greens.
Right, it's a perfectly balanced game of musical chairs.
But when you swallow a multivitamin containing 25 micrograms of pure concentrated vitamin K every single morning,
You are suddenly dumping dozens of extra players into the game. You completely overwhelm the warfarin.
you are directly feeding your body the exact biological trigger it needs to override the medication and start building dangerous clots.
Exactly. It is a profound reminder that with these medications, every single variable matters. You are basically walking around with a highly sophisticated, closed-loop chemical laboratory inside you.
But this raises a massive logistical issue. With all these overlapping mechanisms, competing receptors, liver enzymes multiplying, platelet aggregation, vitamin K cascades, how is a primary care doctor supposed to manage all of this in a standard 15-minute appointment?
They can't. They simply can't. And the current medical infrastructure is completely failing to catch these interactions.
Because doctors are human, right? They cannot hold the metabolic pathway of every single botanical supplement and pharmaceutical drug in their working memory.
No one can.
We rely on automated computer alerts and the clinical software to flag these dangers. But the JMIR human factors study in our sources highlights a severely broken system.
Yeah, doctors are currently overriding automated computer alerts for drug interactions up to 90% of the time.
Wait, 90%?
90%. The software flashes a warning about CYP enzyme induction, and the clinician just clicks ignore due to severe alert fatigue.
That's crazy.
Well, the traditional model is incredibly clinician-centric and just way too text-heavy. The doctor gets a pop-up filled with confusing medical jargon like CYP3A4 inhibition or prothrombin time fluctuation.
And they have to make a split-second cognitive calculation.
Right, so they often dismiss the alert to save time, leaving the patient entirely out of the loop.
Well, the JMIR study provides a really cool blueprint for fixing this through a clinical tool called DINTERACT, which stands for drug interact.
Yes, it's an application designed specifically for shared decision-making right there in the exam room.
And while the study specifically tested the dangerous drug interaction between warfarin and NSAIDs, like over-the-counter ibuprofen, the framework they built is the exact solution needed for the natural supplement crisis.
Because DINTERACT changes the entire power dynamic by making the invisible chemistry visible to the patient.
How does it do that?
It utilizes dynamic icon arrays. Instead of a text warning, the screen displays a visual data representation. Imagine a grid of 100 little figures.
Okay.
The application calculates the patient's specific, personalized statistical risk based on their exact age, medical history, and concurrent medication.
Now that's smart.
Then it actively colors in a specific number of those little figures red to show the exact statistical probability of suffering a major gastrointestinal bleed if they choose to mix ibuprofen with their warfarin.
So what does this all mean? It basically translates the abstract concept of risk into a tangible, personalized visual. So when researchers put this in front of older patients, specifically demographic groups aged 65 to 85, who are traditionally used to a paternalistic medical model where the doctor just dictates care, how did the visualization change their behavior?
The behavioral shift was immediate. Once the patients could actually see their statistical risk of a severe bleed mapped out in red on the screen, they felt instantly empowered to change their own treatment plans.
Oh, wow. They took control.
They did. They actively pushed back against the risky medications. They asked the doctors for safer alternatives, opting for physical therapy or acetaminophen instead of the NSAIDs.
It proves a fundamental point about healthcare. Patients aren't stubbornly clinging to dangerous medications or supplements. They simply haven't been given the proper translation tools to understand the underlying biology.
That's spot on. When you replace medical jargon with clear, personalized visual data, patients inherently want to make safe choices. If a clinician had a tool like DINTERACT that could visually map out the enzymatic risks of St. John's wort or the receptor competition of black cohosh and show a patient exactly how it impacts their tamoxifen or warfarin,
it would revolutionize patient safety overnight.
it really would. It moves the entire process from paternalistic dictation to active collaboration.
Which brings us to the ultimate takeaway for you listening right now. Your cells, your liver enzymes, your blood platelets, they do not care if a molecule was synthesized in a patented laboratory or grown in a field.
No, they don't. It is all just chemistry. Your biology reacts to the molecular structure, not the marketing on the bottle.
Because of that, you have to step up and become the active CEO of your own healthcare. The first rule of effective management is full transparency. You must disclose every single tea, tincture, multivitamin, and capsule you consume to your doctor.
Every single one, even if you bought it at a grocery store, and even if it feels completely harmless.
Put every variable on the table, because what you don't declare can completely derail your medical treatment. Before we wrap up this deep dive, there is one final, incredibly provocative thought that emerges from all of this data. We have spent this entire time exploring acute, immediate reactions.
A sudden liver hemorrhage, a neutralized chemotherapy drug, an immediate blood clot from a multivitamin.
Right. But consider the longer timeline. We are currently consuming plant compounds and botanical extracts in highly concentrated doses that our human ancestors never had access to.
Right, the dose makes the poison. If a common herb bought at a local health food store is biologically powerful enough to competitively alter cellular DNA synthesis or cause massive hepatocyte death in a matter of months,
Yeah.
what unseen long-term evolutionary effects might these botanical extracts be having on our bodies over decades?
What subtle chronic alterations are happening to our gut microbiomes?
Yeah.
How are these unverified molecular structures interacting with our neurological pathways over a lifetime?
It's a huge question. We are essentially running a massive, uncontrolled global chemistry experiment on our own internal
We
ecosystems.
really are.
These are vast, interdependent biological systems that science has barely begun to properly measure, let alone fully understand.
It really makes you reconsider the idea of a harmless natural remedy, doesn't it? You might think you are just planting a single decorative flower in your garden to help manage some hot flushes, but without knowing it, the roots of that plant are aggressively wrapping around your plumbing, altering the water pressure, and changing the entire infrastructure of your system.
And once those roots take hold, untangling them is a lot harder than you think.
Respect the profound power of the chemistry you put into your body.